Good morning, good morning, good morning, everyone. This is Councilwoman Felicia Porter, and I'm super grateful to have Joy Rhoden here today to talk about Black maternal health. She has been a mentor and a friend, and I'm super excited to have this conversation with all the work that she's doing in Black maternal health. How are you doing today?
Awesome, awesome. So glad to be in community with you. This is
Good.
gonna be a good convo.
Yes, I'm super excited. So, first, talk to us about some of your work at the American Hospital Association. When we came into community with each other, we were talking about some of the great work that you're doing at the American Hospital Association.
Yeah, sure, sure, sure. That's a soft toss, so thank you. So I actually have the honor of leading our division of health outcomes and care transformation. The American Hospital Association represents nearly 5,000 member hospitals and health systems. So that's most of the hospitals in this country. I think there are what, 6,100 hospitals.
Mhm.
Most of them are our members, whether they're investor owned, small, rural, suburban, large academic medical centers, or traditional quote unquote safety net hospitals, essential, you name it.
Yeah.
They're a part and parcel of our membership, which makes it very challenging, as you might imagine, right? To create policies and practices and craft an agenda
Yeah.
that can meet the needs of our disparate members. So what we've been busy doing in the maternal health space, and I will just say the division has four verticals
Nice.
that we cover. Addressing health disparities,
Mhm.
the work around care delivery transformation. What are those new care models that we need? The social drivers of health, which I think we'll talk a little bit about,
Yeah.
and maternal and child health, which is where we're going to spend the bulk of our time today. So that at a very high level is the work that it resides in the portfolio of this division. One of our long-standing initiatives is our Better Health for Mothers and Babies initiative,
Yes.
right? And I
Yep.
think we
We talked
introduced
about
you
that.
to
Yep.
that before. And I hope it's a shared goal because our goal is pretty audacious. It
Hmm.
is to eliminate preventable
Yes.
deaths, right? And really to work with our member hospitals and health systems to craft strategies and approaches that will get us closer to that goal.
Yeah.
So starting with looking at their data, because I will always make the case
Yeah.
that it is an imperative if you're going to do any disparities focused work,
Yep.
you have to understand your organization story from a data perspective.
That's correct.
Where are those gaps?
That's correct.
Why are they occurring? You really do have to interrogate and analyze your data,
Mhm.
but start by collecting it in a systematic and standardized way, and then doing that analysis on the back end. And so data is at the top of our list, and then understanding again different outcomes that different subgroups are experiencing within a patient population. And
Yeah.
you can slice that whether it's race, ethnicity, insurance status, educational
Yeah.
levels, all of the above, right?
Yeah.
Really matter. Then we talk to our members about it's a four-pronged stool. I'm kind of going around the wheel here
Mhm.
around integrating patient voices,
Yeah, that's
right?
huge. That's huge.
So the lived experience,
Hmm.
bringing community members in,
Hmm.
hearing firsthand, how are you experiencing
Yeah.
the care setting when you show up? What
Yeah.
what are some of those opportunities that
Yeah.
exist for the provider? And then certainly the notion around empowering, when I talk about the care delivery transformation work, multidisciplinary care teams,
Yes.
right?
Yes.
So I was rooted, my early career when I launched into social work was as into healthcare was as a medical social worker,
Yes. I remember that.
right? And so I was trained in the biopsychosocial model,
Yes.
where the person in front of you is not just a patient. No one raises their hand and say, I really want to be a patient today,
Yes.
right? We find ourselves in these situations where we're at our lowest points, right? And you're approaching a healthcare system that
Yes.
you trust to
Yep.
coordinate
Yes.
your care. And so the biopsychosocial makes you think through what are those other factors,
Yes.
those upstream factors
Yep.
that might come to bear on one's ability
Yes.
to participate in their care?
Yes. 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 All of that. And that's such a great segue when you talk about those upstream factors. And so when I talk about policy in Baltimore, I'm like, how does the environment, how does everything that is attached to that person impact their healthcare? And those upstream factors, we know that but Black maternal health is at a disparity. And so we know that these issues exist. Some of those can you explain some of those upstream factors that you talk about? What are some of those upstream factors that you see in the system
Sure.
for Black
I
mothers?
mean, I think it's, you know this as well
Mhm.
as I do, that it's well documented, right?
Yeah,
That most of one's overall health status and well-being
yeah,
is not medical care. It's
that's
not healthcare, right?
that's correct.
So only about 20% is attributable to health care.
That's correct.
So we should be thinking about that other 80%, the
Mhm.
outstanding 80%, and what are those factors? So
Yeah,
whether you're thinking about access to healthy foods
yeah.
or the environment itself,
Mm-hmm. Mm-hmm.
where in which one resides, housing, how
Yes.
stable their housing
Very,
is,
very, very true.
um, access to care is
Mhm.
also important. Insurance status is important.
Yeah,
One's educational level,
yeah,
all of these things we know factor into whether it's health literacy
yes,
goals or, right? It all starts to make sense when you think
yes.
about, well, if I am food insecure, am I really able to engage with this higher order,
Yes.
right?
Yeah.
Coordinating and weighing in and being a real decision maker around my treatment plan. If
Yes.
I'm worried about what am I going to feed my unborn child
Yes. Yes.
and
Yes.
maybe my already here child,
Yes.
right?
That's correct.
So it's particularly concerning for hospitals and health systems because it all gets deposited on our front doors.
That's correct. That's correct.
Right? So
Mm-hmm.
we see the confluence of all of these factors showing
Yes.
up in our emergency departments,
Yes.
which is a really expensive point of care.
Yes, it is.
And when emergency departments start to function as primary care settings,
That's correct.
that's not good for the healthcare
It's
system
not.
writ large, right?
And you're absolutely right. And I'll tell you, one of the other major issues that it's just so concerning is that making that connection between the hospital system, government, and community-based organizations. So, for all that are aware, I chair the Public Health and Environment Committee. We are really intently focused on making that three-pronged connection to include our hospital systems, to include our community-based organizations, and also government resources as well. Um, how can we as an entity better partner with our hospital systems? What can government and community-based organizations do? Because you mentioned the upstream effects for Black
Mhm.
maternal health, 80%. A lot of that is going to come from city resources, it's going to come from community-based organizations. How can we be a better partner to hospital systems in that respect?
Yeah, we actually at the AHA developed a social drivers of health framework to
Oh,
help
nice.
our members think about their role as the convener.
Yeah.
Because in many of the communities where our members operate, we are the largest employer.
Mhm.
We
That's
do
correct.
contribute to the economic engine, right?
Yeah.
We're a huge driver for the economics of the communities where we operate. And so with that become there's some it wields some power, if you will,
Yeah. Yeah.
right?
Yeah.
And so you start to think about how do you share that power in a way that you can bring together all the stakeholders
Yeah.
to design for the health of that community.
Yeah.
So when the hospital CEO calls and says, look, we need to sit down and meet, folks come to the table.
Yes.
And so it's bringing in the public health agency, it's bringing in the transportation authority officials,
Yes.
the school board presidents,
Yes. That's
right?
correct. Yes.
It's it's come on, come all.
Yes.
Let's bring our best thinking, our best
Yeah.
talent
Yeah.
to collectively and to
Yeah.
also make sure, Felicia, that we're not duplicating efforts.
That part. Say it again. Say
So
it
folks
again.
aren't colliding into each other.
Oh,
And at the end of the day, we're saying there aren't enough resources.
Yes,
Well, maybe we should prioritize
yeah,
because hospitals, we're not in a position to do it all,
that's
right?
correct.
And
Yeah,
so it really does require that there's everyone have some skin in the game and
yep.
everyone recognize that we all have to play a role everyone in that
The
ecosystem.
ecosystem, yep. And it's a
Yep.
delicate balance, it's a
Yep.
delicate balance. And I
Yep.
think that we have major public health institutions here in the city of Baltimore where we work very hand in hand. The city of Baltimore works hand in hand with the hospital systems.
Hmm.
And what I've been doing is making sure that the community-based organizations are also at the table as well because they are like the community health workers, the frontline
That's
people.
right.
Once they're in community, how can we deliver the resources and impactful resources to them so that if they should need to go to a medical home or a healthcare institution, they have that warm handoff. And
That's right.
particularly with Black maternal health, we see advances and initiatives like the doula support. We see the advances and initiatives like the midwifery reimbursement codes at the state level. Like the ecosystem has to change not only from just delivery to program to reimbursement to healthcare delivery to the public health system as that person has the baby goes into
That's
community
right.
as well. So that's beautiful. I want to end with a wish list. So, you and I have had very, very great conversations about policy and healthcare at the local, state, and federal level. If you could change one thing as it relates to maternal health in 2026, what policy initiative would you kind of really press or what can our folks really focus on?
So I think ensuring access is going to
Yes.
be really important,
Yeah.
right? Ensuring access to care
Yep.
and also the affordability of that care,
Yes. 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 Yes.
right?
Like that. Yeah.
And the latter, we've made some progress around the access, which
Mhm.
now we need to work to protect and preserve,
Amen.
right? And and safeguarding federal funding for Medicaid in
Yeah.
particular
That part.
is going to be really important for this population that we're
Yeah.
talking about, right?
That's
Because
correct.
as you know, about 4 in every 10 births in this country is to a Medicaid mom.
Yes.
And so the importance of that program for this population cannot be overstated.
Yeah.
But the affordability of care is also a barrier for so many folks in Black and Brown
Yeah.
communities,
That's correct.
underinvested communities. And so I think at the end of the day, we've made some progress
Yeah.
way back with the ACA around improving access,
Yeah.
but we can't sleep on the job,
Mm.
right? We can't take it for granted. And there are always forces and efforts and agendas that are out there to erode at some of those gains that we've made. And so I think we've got to stay the course.
Yep.
The other truth is, if we stick to the Medicaid example, reimbursement for Medicaid,
Amen. Say it. Look, say it again. Mm.
right? Reimbursement
Yes.
for labor and delivery services through
That's correct.
Medicaid
That's correct.
is way below the
Way below.
cost of care.
Yes.
And so we also need to advocate for higher reimbursement
That's correct.
if
Yes.
we want these providers to stay in the game, taking care
And
of.
also higher reimbursements for the integrated medical team. So it's not just,
That's right.
it's not just physicians or nurse practitioners. It's the nurses, it's the doulas, it's the
It's the
midwives.
doulas.
It's all,
Yeah, it's
all of those
all of
things,
these
all the
extenders of care, right?
That's correct.
Yeah,
No, I appreciate that. And, just for you all, we have an informational hearing coming up in my committee, the Public Health and Environment Committee, where we are talking with the City Health Department on their new Be More Healthy Babies strategy that they have developed. And all the things that you're talking about are integrated within that plan and even in connection with some of our legislators at the state level as well. So, Joy, I'm super grateful always to talk with you about a topic that's really important to me, especially during Black Maternal Health Week. And it's something that I think we really need to be focusing on if we want to see the type of care within our children and our communities that we really, truly need to see. So thank you so
absolutely.
much for joining with me today.
Thanks for having me. It's a
Wonderful.
pleasure.
Thank you.